The Ontario Health Coalition is trying to pressure the Ford government to stop awarding new long-term care licenses to for-profit corporations. The local coalition held a news conference this morning to highlight the fact that companies like Southbridge are being given the green light to build a new 160-bed home in Thunder Bay, despite having the highest number of COVID-related deaths in the province. Kurt Black reports.
For Doug Ford to sit there last year and cry crocodile tears saying, I didn't understand how bad it was. That's craziness. It's absolutely crazy because the Thunder Bay Health Coalition, the Ontario Health Coalition, Natalie Mayer and the Ontario Health Coalition have been pounding this year after year after year about the issues in long-term care.
The Thunder Bay and Ontario Health Coalitions are calling on the Ford government to prioritize allotting new beds to non-profit facilities rather than for-profit corporations. Local coalition co-chair Jules Tupker points out that Southbridge, which manages 3 long-term care homes in Thunder Bay, saw the highest pandemic death rate at 9 residents per 100. But despite that, Southbridge is being given a license for a new 160-bed facility on Clavette Street, which will replace an aging 131-bed home on Vickers Street.
They have Lakehead Manor is going to be rebuilt, and they've already found the location, so we're too late to actually stop that license being issued.
At the heart of the issue is a lack of sufficient staffing at many homes, which is an issue that has been exacerbated by for-profit facilities.
For-profit have gotten away from full-time staff because they don't have to pay benefits to part-timers. So they've created this massive number of part-time employees. And so these workers are working only part-time here or part-time. They're working at a couple of homes. So it's not a desirable place for them to be.
Making matters worse, in the past under the Long-Term Care Homes Act, it was the government's responsibility to promote long-term care services to not-for-profit organizations. But under Bill 37, this phrase has been changed to include mission-driven corporations.
And of course, every corporation, for-profit, not-for-profit, are mission-driven. So what the Ford government has done now is opened the door for-profit corporations to be on the front line of giving services in long-term care.
The former act expressly forbid the issuing of licenses to any operator with a poor track record, but that barrier has been all but eliminated by Bill 37. Officials from Southbridge did not respond to our request for comment on the Health Coalition's report. Kurt Black, TBT News.